Hi everyone! Today we are going to talk about comprehensive pain management because when you are dealing with pelvic pain, it is never going to be a quick fix, and it's usually not going to be just one thing that does the trick. And that is why it's really important to have a team of healthcare professionals that are truly a team. The way that I like to put it is that we are all in your canoe as a patient, and we are all paddling in the same direction to help you reach your goals. So that might involve your primary care provider. It may involve a gastroenterologist, a gynecologist, a pelvic therapist, and it may involve a mental health therapist, counselor, sex therapist, or somebody in that realm. And one of the things that I want to highlight is that a lot of times there's not just one pattern that is going to fit every single patient. And for that reason, it's really important that your pelvic therapist, who often acts as a bit of a quarterback to manage you between all these different providers, and that they have a lot of different tools in their tool belt, including exercise management, manual therapy skills, appropriate use of tools, maybe a wand or a dilator, and then also really good trauma-informed care. One of the most profound components of pelvic pain management and reaching your goals and coming out on the other side is management of stress and the nervous system. There's a couple of really phenomenal providers in this space here on Instagram that I want to highlight. One of them is PT for Women. Even though her name is PT for Women, her content is really for everyone, and I know that she would say the same. But Anne is a doctor of physical therapy specializing in pelvic health, and she does a lot of education on vagus nerve management and calming, and that is really, really profound in terms of how we regulate our pain, how we understand our sensory system and what the signals our body is trying to tell us versus sometimes when it's heightened or ratcheted up and giving us false signals of threat when there really isn't any. And then the other is the holistic psychologist. She's got a really profound knowledge of trauma and how that masquerades in our adult lives, things that have happened to us, the experiences that we've had, and she puts things in a really easy to understand way that can be really eye-opening, and she does a lot of great content on Instagram as well. So that's all to say is that we are nearing the end of May. May is Pelvic Pain Awareness Month. Pelvic pain has been increasing in terms of numbers of people suffering, and we are certainly here on a mission here at Intimate Rose to help all different types of people manage their pelvic pain, be empowered to overcome those sensitive health issues, and we want to make sure that you know that these different avenues are available to you. Find somebody who's listening and don't stop trying. In terms of reaching your goals, it's not going to be a quick fix. It's very hard to stay patient, but it's very important to keep showing up for yourself day after day. One of the things that I always like to remind people is the time is going to pass anyways. So the little things that you do every day, whether it's making sure you're drinking plenty of water, getting out even just for 5 minutes for a little walk to calm your nervous system and get some movement, doing a session with your dilator, even if it doesn't go in all the way that day, doing your stretches, talking with a friend, seeing your counselor, all of those things add up. And then when the time passes, you will be that much closer to reaching your goal. I hope you all are doing well. And if you ever have any questions or need support, we are always here for you every step of the way. You can reach us at support@intimaterose.com. You can reach out here and we will get back to you. Have a great day.